Welcome to the Phoenix Health Bariatric Surgery information presentation for new prospective patients. Today we will cover the following topics: pre-operative diet, post-operative diet, long-term eating post-bariatric surgery, mindful eating, things to avoid, principles of healthy eating, supplements and blood tests, things to consider, and follow-up by Phoenix Health. The liver-reducing diet or pre-operative diet is a low-calorie and low-carbohydrate diet which is usually started 2 weeks before surgery. This diet helps to reduce the size of the liver prior to surgery. It is approximately 800 calories and less than 100 grams of carbohydrate per day. You will be provided with an information pack prior to surgery, which includes information and meal suggestions for both the pre-op diet and also the post-op diet. The post-op diet. Stage 1 diet starts straight after surgery. This is a pureed food diet and will continue for 4 weeks. Pureed meals and snacks can be prepared using a blender to obtain the correct consistency. Ensure that they are low in fat and sugar. Puree meals can be prepared prior to surgery and frozen in the correct portion size. The portion size for stage 1 diet is a ramekin dish, and you'll use a teaspoon to eat. You will need 3 small puree meals and 1 to 2 puree snacks per day. Skimmed milk powder can be added to the puree meals to increase the protein content. After 4 weeks on puree diet, you will move on to stage 2 diet, which comprises of soft foods that can be mashed with a fork. Ensure that the meals are low in fat and sugar. This will be for 4 weeks, and the portion size will continue to be that of a ramekin dish, having 3 small meals a day and 1 to 2 snacks. After 4 weeks on soft diet, you will progress to stage 3, which is long-term healthy eating. Different textures of foods can now be included in the diet, and a healthy diet can be enjoyed. This is the time to try different healthy meal choices that are low in fat and sugar. Some foods may be difficult in the early stages, such as stringy vegetables, fresh bread, and tough meats. Long-term eating. Your long-term healthy eating plan will include normal foods and different textures. This stage is very much trial and error, and it is important to try a wide variety of foods. Foods such as rice, pasta, and some meats may be challenging at first. It is important that your food choices continue to be low in fat and sugar. Remember to include good sources of protein such as meat, fish, eggs, beans and pulses, and vegetarian protein options. Your daily protein intake should be around 60 to 80 grams of protein per day. It is important to have a regular meal pattern, including 3 meals a day and 1 to 2 snacks. The portion size is now a side plate. When eating, we advise to start with the protein element of your meal first, then move on to your vegetables and salad, and lastly the carbohydrates. Mindful eating. Mindful eating is important after bariatric surgery. We advise using the 20-20-20-20 method. In essence, you take a piece of food the same size as a 20p piece, chew the piece of food 20 times, wait for 20 seconds before you take the next bite. Your meal should take around 20 minutes. Ensure that there are no distractions and be in the moment whilst you are eating. Eat at the table and focus on the experience. Mindful eating is beneficial and improves digestion, increases the pleasure of a meal, and helps to reduce intake. Things to avoid. Things to avoid after surgery include smoking or vaping, alcohol, and fizzy drinks. Additionally, it is important to avoid non-steroidal anti-inflammatory drugs or NSAIDs such as ibuprofen and naproxen. It is important to ensure that you do not drink when having meals. You need to avoid drinking approximately 10 minutes before a meal and for 30 minutes after a meal. Principles of healthy eating. After bariatric surgery, it is important to have meals and snacks that are low in fat and sugar and high in fibre. Minimise convenience foods where possible and try to include 5 portions of fruit and vegetables a day in the diet. Having a regular meal pattern is very important after bariatric surgery. 3 meals a day and 1 to 2 healthy snacks. Your portion size is a side plate. Eat until you are satisfied, not full. Use the mindful eating techniques to help with this. Have plenty of low sugar and low fat fluids. Aim for at least 2 litres per day. Supplements and blood tests. After bariatric surgery, you will need lifelong vitamin and mineral supplementation, including calcium tablets and A to Z complete multivitamin and mineral supplements. You may need vitamin B12 injections or other supplements too. You will need to have regular blood tests from your GP. These results need to be sent to Phoenix Health where they will be reviewed. The blood tests need to be done every 3 months in the first year and every 4 months in the second year and annually after this. Things to consider. There are some things to consider prior to surgery. Hair loss or hair thinning can sometimes occur due to rapid weight loss. This is usually temporary. It is important to be aware that fertility can sometimes increase due to weight loss. Symptoms that can occur after surgery include acid reflux, constipation, loose stools, nausea and vomiting. You can help to minimise these symptoms by following the correct dietary advice, such as having a regular meal pattern, choosing meals and snacks that are low in fat and sugar, and eating mindfully. If you have any concerns, please contact us. Loose skin can occur as a result of weight loss. It is important to be aware that weight gain can occur if the bariatric dietary advice and lifestyle advice is not followed. Follow-up by Phoenix Health. Your hospital stay will generally be for approximately 48 hours. You will receive a call from one of our specialist bariatric nurses and your surgeon. You will have regular follow-up appointments. Phoenix Health has a multidisciplinary team of surgeons, dietitians, nurses and psychologists to provide extra support if required. So to summarise, bariatric surgery is just a tool to empower you to implement a healthy eating pattern and incorporate more physical activity into your lifestyle. It is not an easy option, and success depends on implementing positive lifestyle changes and compliance with health professionals' advice. Please contact us on the telephone number provided or our email address for further information. Thank you.